actually some personal, hobby horse for me, some personal favorite. And the reason is that I'm personally a little bit in the holistic and in the natural things of when it comes to the body, at least. I haven't taken an
Sure.
aspirin for millions of years or something like that. And the only medicine I get if you dentists give me a shot when you need to do something. So the point is, gum disease. To me, it looks like every dentist, when he talks gum disease, the first thing he talks about is you will be losing your teeth. Sooner or later, 2 years, 6 years, 10 years, you will lose them. Now, I'm not saying that that's not a bad thing, and I'm not a bad thing, and I'm not saying that this is wrong. It probably, it sure will happen. But here's my thinking about it, and that is, if you have an infection, that yellow, reddish, ugly pus, which, when you're infected, which is in your mouth, the gateway of the blood vessels. We know that because, when you take some type of medicine, salt, whatever it is, you go, "Ooh, I'm back." So when you put it under your tongue, so it drips into your blood vessels. It has a foot to the heart, a foot to the brain. It goes everywhere. It gets mixed up with the food you chew. It gets into the stomach and grows from there. It seems to be affecting the liver, the kidney, the heart, the brain, dementia. It lowers your immune system like there's no tomorrow. You get more colds, more flus, which is couldn't be comfortable at work or anywhere. You're more grouchy because of the flus. You're missing work. You cannot be as alert. To me, it's devastating. It couldn't be easy to fix all those organs. Apparently, it has things to do with diabetes, name it. Um, am I way off here? A little infection in the mouth doing the things I think it will do just because I'm comparing it with a normal infection, which would have that effect? Give me your
Yeah.
take on it.
Well, we're rapidly starting to find more and more links between gum disease and systemic issues. We definitely are certain that gum disease has systemic impact on the patient. Um, when you have periodontal disease or gum disease, you are perpetually seeding your body with bacteria and inflammatory related byproducts. And they impact, and they work synergistically. For instance, if you have diabetes, we now know that diabetes works synergistically with gum disease. One makes the other one worse. So your gum disease will actually impact your diabetes and vice versa. Um, and systemically, we know that gum disease increases systemic inflammation and has a correlation to impact all sorts of different other issues in the human body. It's really, really important um, to address gum disease not only for the health of your mouth and the health of your teeth, but also for you systemically. And we cannot emphasize that enough. That is definitely very, very
And
important.
so are you saying that you actually agree with it, with what I said? You see, it's not good to lose your teeth, but at the very least, just talking to you, you guys do a good job replacing teeth with implants and all kinds of stuff. We these days have implant-supported denture, which again seems to be a miracle in itself, which I think we want to talk about it one of these days. But it's all the other problems there, which are so bad. I mean, having an immune system down. I've heard there was a study in Japan from a university. They said that people with gum disease, if they happen to have AIDS, now thanks God, I mean HIV, thanks God, not a lots of people have HIV, but
Right.
if they have HIV, they will be getting the AIDS because HIV in itself doesn't mean they get AIDS. It will trigger it much faster simply because of a lowered immune system. Now, if it does something so drastic, what about the other little things? Is what I'm asking, and that's I think why we should keep our gums healthy.
Yes. No. No. Periodontal disease has a very significant systemic impact. It systemically increases inflammation, and it'll have an impact on all other organ systems, um, and
Yeah.
and we're discovering more and more daily. Daily, we're learning more about the impacts. We do
Since you,
know that
since you,
it's just not a, sorry, Helmut,
no,
it's just not a dental issue. It's definitely an oral systemic issue that needs to be paid attention to. And I don't think we know all that we need to know yet. I think we're going to be discovering a lot more still. But so as a clinician, it's very important that we really pay attention to the health of patients' gums, and that we take the time not to scare people. We don't want to scare people and use scare tactics, but present them what the science is putting forth in a clear manner so that they can understand it, and give them also resources for them independently of you. Because if you get on the internet, you can find out a lot about gum disease,
right.
and really holistically inform them about their condition and its impacts. And,
Is it true that is it true that more and more surgeons, the people who do hip operations or appendix or tonsils and things like that, that more and more of them, before they do a surgery, they demand now a clean bill of oral health, and by that they don't mean a couple cavities or an orthodontic work to be done. They mean periodontal disease to be checked, because they have found that if they do an operation, the gum disease can influence there wherever they cut. It makes it not healing, and or the body is so weak that the operation otherwise creates difficulties. Is that true that is becoming more and more the norm from the surgeons to ask for that?
I have certainly seen more and more of that happening. Unfortunately, actually, our medical brothers are really not up on the oral issues as much as they should. But there are some savvy MDs that are really understanding the link, and are definitely communicating more and more with their patients' dentists, and wanting to make sure that we rule out other issues that could impact the success of the medical success of what they're doing for the patient, and not let a dental problem impact that. That certainly is happening more and more.
It seems to be like that the savvy ones you're speaking about seem to be in the surgery area, as they probably have noticed some of their surgeries directly failing and then had to explain it. And of course, as any good doctor, they would start research and research and research. But it is amazing, you're right, that the average general practitioner isn't insisting at the slightest immune system problem a body has to go and say, what does your dentist say? Go and give me his, I want a report from him. Well, all right. So, go ahead.
No, I was agreeing with you. I say, yeah. This is a learning curve for them also.
Sure. But
this is not their field, so
it's okay for the patients to be educated before the MD, right?
Yes. But many times that is the case. The patient will tell the MD what they learned at the dentist, and the dentist goes, the MD goes, oh, okay, let me call him up.
Well, the truth is, when I went to school, I already heard from the teachers, and there was like, I don't know whether it was a doctor speaking, that it was known already, gum disease and heart disease. But it's one thing to know about it, and it's another thing to act on it. And the acting is still a little neglected, I think.
Yes, absolutely.
Good. Well, again, it was wonderful talking to you, Dr. Chavez. Bye-bye.
Likewise, Helmut. Thank you very much.